All right, so thank you everyone for being here for our nonprofit social work panel. We're going to start the panel off today with our first question. I introduced all of you, but could you share a little more about your position, title within your organization, and maybe a brief description of what that entails outside of what we just talked about? So I will open it up to any of the panelists. It looks like Lamont, you're already you're unmuted. So if you'd like to start for us.
Yes, I'll start. I'm the interim program director at Life is Work, and I'm also a board member. And what I do as with the social work end of it is the behavioral health, looking at the individual and their social needs, whether it's housing. We have a lot of returning citizens. We have we facilitate groups. Of course, we do social justice, but it's basically making sure that all the components from behavioral health to medical to social, whatever need that the client will have, that we work to either fill the need in-house or give a referral out to another partnering organization. And we do
Fantastic.
thing. I do that. I have a staff, about 5 people. We have volunteers that come. We do, I work with our food pantry and a lot of other different things.
Great.
I'm just trying to think of everything and not take a lot of time. Thank you.
There's a lot going on I think at everyone's different organizations, and thank you for the work that you do. So I think we'll move over to Peggy, if you don't mind sharing next for us.
Okay, so my name is Peggy Howard, and like Nate said, I am Associate Director of Immediate Services. And what that really entails is that I am over 2 programs. I am over our shelter program and our daytime drop-in center. So at our daytime drop-in center, both programs is for anyone who identifies as female, single, and homeless. So at the drop-in center, ladies can come there from 9 to 4:30, watch TV, shower, get lockers, eat, work on their resumes, get case management. Where the shelter part, the only difference is that the ladies here get to stay every night, but they get the same services. They get case management, meals, computers, lockers, showers, laundry. I have about a staff of 15. And like Lamont said, volunteers. We do a lot of referrals for our clients who need mental health services, physicians, resume writing. Let's see what else. I also deal with contracts, funders. I actually took part in helping to build this new building I'm actually sitting in right now.
Great. Well, thank you, Peggy. We appreciate you being here and everything that you've been doing. So thanks again. And I think I just froze for a moment. So thank you, Peggy, for being here, if that didn't come through correctly. And we'll move over to Paul and Evangeline. Welcome from L'Arche, Chicago.
Thank you. Yeah, so L'Arche has 3 homes in the Forest Park and Austin neighborhoods. And within those 3 homes, there are 11 core members or adults with intellectual disabilities. And so in my role, I work closely with the core members around medical appointment management. I write their or help write their annual plans. When they were in public schools, they were called IEPs, and now they're called ISCs or ISPs. Yeah, so there's a lot of letters in my job. Acronyms is the thing. So I do a lot of planning on like, what's the core members' goals? What are their hopes for that year? And how can we as an organization support them, and then refer out as necessary. So I work with a lot of like physical therapists and physicians and occupational therapists and board certified behavioral analysts, kind of networking all those pieces together for the 11 core members that live in West Chicago.
Great.
And then I am the director of residential services. So kind of in some ways the counterpart to Evangeline, I work closely with the assistants who live in and work in our homes. So they are the people who support the core members throughout their day, kind of helping them get around, helping them in the homes with meals, kind of just spending time together. And so in my role, I started working as an assistant and now sort of help supervise and coordinate the assistants who live in our homes and work in our homes. Yeah, and so part of my job also then entails, things like training, finding people who want to work in our homes, so recruitment, and then sort of ongoing formation and supervision. Yeah.
Fantastic. Well, thank you. Welcome to all of you. And moving into our next question. So a lot of the students here are starting to learn what it's like to go on a career journey. What's your professional journey? And I can tell you my path to what I'm doing today was not linear, and that may be the case for a lot of you here. So would you mind sharing your professional journey and how you got to where you are today? That could include any degrees that you received, maybe certificate programs, and any related experience you built on prior to graduating from any of those programs. So anything you would encourage our students to do. And we can start with whoever wants to go first.
I'll go first again. My professional journey, where I'm at now, dealing with social work and all of that, didn't start that way. I went to the Fashion Institute of Technology and got a degree in fashion design and a master's in fashion design and got burnt out, sort of. And so I went back to school and got a degree in religion and philosophy. And then I went to seminary afterwards and got my MD, of where I focused on sustainable urban development and HIV and AIDS within the Black community, because that what drew me to it is because the in Black and Brown communities, we don't hear about it now. The numbers are still rising. So that's what drew me in to say that's sustainable urban development, and we get everybody into care. I also work with HBCUs, historically Black colleges and universities, to get Black and Brown students to show them how their degree can cross over into social work. So this way we have Black and Brown people more represented in the social work field.
Fantastic. Thank you for sharing all that. And like I mentioned, career path does not have to be linear. And I love hearing that you went for some of your passions at the beginning and then decided to do something else. You can always rebrand yourself. So Peggy or Paul, Evangeline, who would like to go next?
Let's see. I originally started out in nursing. And then I realized I don't do well with blood. So I left there and then became a paralegal. I left there because I didn't like that. And I went to volunteer somewhere. I can't remember right now. And it was working with volunteering with youth. And that was the first time that I felt like this is where I belong. And from volunteering there, I went to school. I got my bachelor's at Governor State. I did internships. I did my internship with the city of Chicago. I did it with another agency I can't remember right now, and I just loved it. And then I went on and got my master's. I didn't have to do an internship there, but I knew that's where I wanted to be. So both degrees are in social work. And from volunteering with the youth, I realized, okay, maybe I'm too close in age. And then I found myself working with single homeless men and women. And that's where I've been ever since.
Fantastic. Thank you. And once again, I hear a maybe not linear career path or stumbling upon something serendipitously and realizing this is what I feel called to do now in my life and feel that connection. So Thank you for sharing that. And Paul and Evangeline?
Yeah, I can share. So I was actually an English major in college and taught high school for 3 years after college, and enjoyed teaching, but always kind of felt, there's something more out there. So I went back to school and I did a Master's of Divinity as well. So I got an MTS, Master of Theological Studies. Was kind of always drawn, towards helping people, and it was kind of exploring that path. Initially, I thought I was going to teach at a university level. That was sort of the idea, and go on and get a PhD after. But kind of found myself drawn more towards something a little more on the ground rather than in the books. And yeah, after graduating from my master's program, joined Large Chicago here. And started working with adults with intellectual disabilities, and found I really loved it. It was like the same energy that always like channeled me into teaching, channeled me into like spirituality and ministry, but just kind of found a new route and found a new place to kind of, yeah, plant itself.
Cool.
Great.
Yeah, I graduated from college. I was a double major in religious studies and anthropology. I like to say I have a degree in people watching. And I knew that I wanted to live in some sort of intentional community after graduating college, but was not excited about like living with 22-year-olds anymore. And so I wanted an intergenerational, intentional community. And I have some background in disability. My older sister has a disability, and was doing some like disability studies adjacent work in school, and stumbled across L'Arche through a mentor of mine who recommended it. And I moved into L'Arche Chicago first as an assistant, a live-in assistant. And I was a live-in assistant for just under 3 years. And then did a leadership role within that. I was a house coordinator, and then moved to my current position just over 3 years ago. Yeah. So kind of like it maybe is the more linear, like just sort of like worked my way up in this organization, in this context. I only graduated like 7 years ago. So yeah, I just fell in love with the people, and sort of the timing of these positions opening up fit with when I was ready to try something new or try a bigger challenge. And yeah, still here.
Great. Well, thank you everyone for sharing. So we'll move into the next question, and I'm curious, and I'm sure all of the students are as well. Could you describe your current position and responsibilities on a day-to-day basis? And I'm sure that changes every day. Life throws curveballs at you wherever you are. So what would a typical day look like? And if it's never typical, then sharing that may be really useful for our students as well. So if you could just share your current position, responsibilities that pop up on a day-to-day basis.
My day-to-day activities start with, we have a lot of walk-in clients as well as scheduled appointment clients. And it's basically doing their intake, making sure the rest of the staff has their daily task of what they have to do, whether it's seeing clients. I send a lot of people to rehab, because on the west side we have a lot of addicts, and sitting with them and counseling them to be able to do this. One of the things that I did in my professional development in social work was I went and got my license in marriage and family counseling. So that way, because a lot of times when people call it, when they think of therapy, they're looking at it as the clinical psychology, psychiatrist, compared to if they're, okay, you're this ordained man of God, and I'd rather talk to you than go there when it's the same thing. And just really making sure we have enough people for testing, because we do test for HIV, and basically making sure that each case manager understands and know, like when a client come in, based on what the client needs are, if they don't have the information, I guide them to let them know, call this organization or do it this way. So this way we know that we're supplying the social service need mentally, emotionally, so this way that they can get linked to care and stay in care. And like today, I had a meeting with before this with Laurie's Children's Hospital, because they started a program for LGBTQ, but focused on trans men and trans women of color. So creating a youth program for them, and it's from scratch. So I had to come up with all the activities and all of that to bring that social component together. Whereas I'm gonna be including the parents in it. So this way, because for people of color, when their child comes to them and tell them, oh, I want to transition to a trans woman or a trans man, the parent has some, they have to grieve that they're losing this child that they gave birth in one way to get the other. And there's a lot of social things, part of heat flag and other things, components that go into it to look at the social service and social work side for the parent as well as that child.
Thank you. All right. So who would like to share next?
We can pop in. I'll just talk about what I did yesterday, because definitely all days are different. It really depends on, for me, like medical appointments are a big thing that distract my schedule. So yesterday I met up with a core member and we went to a follow-up primary care appointment because she had a cut on her arm that was infected and it needed to be seen again by the doctor to make sure she had the right amount of antibiotics. And on the way there, we discussed spider venom and dog saliva. And then I dropped her off and I came to the office and did some admin stuff. So checking emails, calling doctors, scheduling appointments, collaborating with this team around different things, care provision wise. And then I think I went to another appointment. Oh no, then I went and I hung out with another core member. And he, because there was a hole in the schedule, so I filled in for another assistant and we went to Walgreens to print out 5x7 photos and buy Doritos. And we chatted about how he hates his housemate's guts. And then I dropped him off and I picked up another core member and we went to a different appointment, and this core member is on dialysis and his fistula was not flowing correctly. And so he needed to be seen by the vascular surgeon. And that's sort of a last minute add to my day. And then I dropped him off and went home. That was the full day. So at any day, there's kind of different things that I'm either expecting to do or that come up. And we do try to support each other on the team to make sure that it feels like a sustainable amount of things in a day. But that was yesterday for me. Your yesterday was comical.
It was very comical. Yeah. So similarly, I think just things come up as they do day to day. So I was expecting yesterday to be like a calmer work day with like a couple meetings, some time to work on. I have like a whole bunch of spreadsheets that fill up a lot of my time and scheduling software. But yeah, ended up having to, step in at one of the homes early in the morning. So I was there. Hanging out, had some breakfast sausages with one of the core members for breakfast. And then kind of ended up doing some admin work from one of the homes. And while watching Daddy Day Camp, which was a sequel to Daddy Daycare, I cannot recommend it. It's not very good.
I love that.
Me too. I was expecting great things and, didn't quite deliver, but it was a good time regardless. so yeah, and then ended up having to go to one of the other homes to fill in as well. So really my day is kind of a mix of, stepping in where I'm needed, supporting assistants where I'm needed, but then kind of in the in-between. Some days are really just also sitting in an office for most of the day and, making ends meet, sort of the less glamorous side of a lot of the work. But yeah, yesterday was kind of exceptionally busy.
Absolutely. Well, thank you to both of you for sharing your busy days and comical days yesterday. I think it's great for the students to hear what a day in the life could be. And Peggy, do you mind sharing what's a day in the life for you?
I have to repeat like everyone, each day is different, but from last week to yesterday, I was doing a lot of training with training new staff. I also yesterday had to do a lot of interaction with the neighbors. Sometimes our clients might have a mental health concern and the neighbors are concerned about what they're seeing. So I do a lot of communication with them, a lot of paperwork. I also help to fill in when I don't have a staff person, so I wear many hats. I can be a program staff person. I can be a case manager. The only position I won't fill in at is a cook because I can't cook. And answering the telephones, it just varies. Engaging with the clients, people from different agencies wanting to know about the program, trying to make linkages that way. So yesterday was a lot, but every day it's something different.
Great. Well, thank you everyone for sharing about just your day in the life. And to all the students out there, it's the same. I think anywhere you go, it's typically you're not going to find a strict routine, especially in the field of nonprofit and social work. And even in education, I can say working at DePaul University every day is different. So, and if you like that, then this is definitely a career for you. I wanted to ask as well, what skills are expected or useful for each of you in your current setting? What types of skills are needed? Maybe you can elaborate into some soft skills as well. What works? What helps you get through each day?
What helps me get through each day is one, the first thing is to be humble and personable, because in social work and in nonprofit, every person you interact with is gonna be different. It's everybody has different issues. You can't sit there and say, I'm gonna use this best practice model, because it's not gonna work. Best practice models is good for writing grants. As far as delivery of services, it won't work because everybody doesn't fit in that box. In my current setting, being able to meet people where they are is the key to social work, and also the key in nonprofit. Because nonprofit and social work is the same thing, it's just a different tax code. That's the only thing that makes the difference. And you just have to say to yourself, if I was that person that was coming for services, how would I want to be treated? And when you look at it from that perspective, as a social worker or working in a nonprofit environment, you're then able to reach the person you're speaking to, you're working with, compared to, you can't come there and use all that clinical stuff, that 18, 20 letter words and all them big books we had to read. That don't work. It don't work whatsoever. So that's the key thing, is always just saying, paying attention to the nuances. So this way you'll know how to gauge what you're doing for the day, because each day is completely different.
Absolutely. Thank you. And I think approaching work with a humble attitude is so important, and just knowing that everyone's going through a different journey. So thanks for sharing that. And it looks like Peggy, you're ready next.
Yeah, I 100% agree with Lamont. Everything that he said is so true. You have to be humble. You have to stay professional and meet people where they are. There is no cookie cutter for each person. You can't use the same one. Each person is very different. And listen, that is the key thing. You have to actively listen to what they're saying, because they want to make sure that you're paying attention to them and not just in the room while they're talking and you're doing something else. And be patient, because the first time you're meeting someone, you might not get all the information that you need. They might not even say anything to you, but to understand patience, it will help you a long way. But I definitely agree with what Lamont said all the way.
Great. Thank you. And Paul and Evangeline, what are some soft skills? What are some skills that are needed in your day-to-day life?
Yeah, I think about my role as sort of having like two legs. There's the relational leg, which is my where most of my focus goes, for better or for worse. Yeah, and would echo what Peggy and Lamont shared about showing up with people. And I think the other leg of my job is just like task organizational elements, my less preferred part of my job, but just being able to do things efficiently and so you don't have to do them again, so it doesn't drag on. I have a problem with procrastinating, like those 5-minute tasks just like pile up, and then I have like 4 hours instead of having done them just as I go. So I think some like task management skills are important in the social work realm, because there's a lot of little details when it comes to people and their care. So that comes up a lot for me. Yeah.
Yeah, I think everyone else has shared a whole lot of wisdom already. I think what resonates a lot right now, though, is also the ability to maybe like let go and like know when to let go. I think just working so closely with people teaches you a lot of lessons about like you want to do so much to be able to help someone, and you can offer so much, but at the same time, like at the end of the day, like you're working with people, and like they're free, they're independent, they will make their own choices. And so I think that soft skill too, like knowing what's in your control and what's not, and kind of being aware of that, has been like very important in my own role as well. And kind of that humility that Lamont talked about in a lot of ways, of recognizing you are, approaching another human being. And yeah, that's the starting point.
Great. Yeah, that's fantastic. All of you shared wonderful wisdom for working in a daily life, but also just your everyday personal life too. So thank you for sharing that. What are some ways that students can begin to build related experience now? What would you recommend for students? And I know I've advertised an internship for Life is Work through Lamont Lewis on our LinkedIn group a few times. But what are ways that students can start building experience today and going forward? What would you recommend?
I would one of the things I recommend, working with HBCUs as well as HBCUs, historically Black colleges and university. I went undergraduate and graduate school at an HBCU. But what I tell the students is think outside the box. Because if you're going into social work for the money, you're not going to be rich. You're not going to be a millionaire. It's going to take you forever to get to $100,000 a year. So when you think outside the box and say, okay, I have this social work degree, how can I maximize that? So, and I tell people, think of a community-based organization. One of the things, when you think of a community-based organization, you're like, oh, I don't have, it's a lot that goes into it. But I tell them, when you go into Black and brown communities, the reason you don't see Black and brown doctors in those communities is because students don't understand that If I go open up a social service agency or a medical clinic in a Black and brown in urban communities, I don't have to pay back my student loans. But the doctors that open clinics and practices in urban areas, that's why those in urban areas, you don't see people that look like people that lives within that community. And you just have to completely think outside the box. I would have never thought, me going to study religion and philosophy, that I knew how I wanted to bridge it over into social work and all of those services. And it's, people are like, I can't believe you did that. But it's relatable to every area. Don't put yourself in the box to say, I'm gonna wanna go do this with social work. Think outside the box of what social work is, and that's where you're able to advance your career. And in the meantime, volunteer while you're in college at organizations, so this way you're receiving that, you're putting that information on your curriculum vitae. I sit on the Broward County HIV Planning Board in Fort Lauderdale, Florida. I sit on CAHEES, which is the HIV Planning Board here in the city of Chicago. I sit on the Illinois Department of Public Health Board for HIV prevention. It's things like that that you make the connections in networking to be able to go into an area of social work that you wasn't even thinking about. And you have to challenge yourself. I tell people all the time, I was born to make you uncomfortable. And the reason I was born to make you, social work is making people uncomfortable. That's the bottom line to social work, because you have to stretch yourself and you have to stretch them to understand from the social work perspective. Social work is not, let me go sit in a hospital setting. You can go into the Department of Health. You can go into schools. It's many different areas that you can go into. And once you find your niche, focus on that niche. But the number one thing is to think outside the box.
Thank you. And that's fantastic, Lamont, sharing transferable skills. What can transfer from things that you've done into these different areas. So for students, that you might be doing a project in class, or you might be volunteering or even working on the side. How does that transfer into working in the career that you're building toward? And getting involved. I think that's another great thing that Lamont shared, is just get involved. And yep.
One of the things that I did was I had to do my clinical in seminary. I did my clinical at Cornell University Medical School. That's why I did my clinical. And I did the grand rounds with the doctors and the residents, and I presented cases. And that gave me that medical side to it. And I bridged the medical to the theological as well as the social work perspective of it. And it gave doctors that were the residents and the fellows and everything, it gave them a different perspective on how social work comes together. And everybody was like, you did what? I did my clinical, that I went to New York and did my clinical for the whole summer with them. And that's thinking outside of the box. Who would think somebody with a master's of divinity would go and do clinical in a medical school instead of doing pastoral care? And in doing that, I received my credentials to be a rape counselor, as well as my credentials in hospice and palliative care. Hospice and palliative care is a part of social work. And that's how all of it comes together, so that on a daily basis, if I'm getting people, I get calls for people needing my help with hospice and palliative care, I'm able to access that and not just help the patient, but also help the family. Because there is a part of social work that is healing. And we have to look at that from a healing perspective. And when you do it that way, it makes the job easier as a social worker.
Great. Thanks, Lamont. I appreciate all that great amount of wisdom. And like I mentioned before, small plug, Life is Work does have internship opportunities. So if you're looking for an internship, Life is Work has options. Um, Peggy and Paul and Evangeline, maybe you have internships as well at your spaces. But like I asked before, what are some ways that students can begin to build related experience now? Could either of you or the three of you talk on that?
Well, volunteer. Um, uh, that's how I started. I volunteered, and then I realized, okay, this is where I need to be. Or make contacts. Just call the places that you're interested in. See if you could speak to the director, associate director, to get some information to help you make the decision on if this is the path that you are really interested in going down. And then sometimes, getting a part-time job. When I was in school, I had to work full-time while I was in school. And so it really helped me to be able to have the internship, be able to work and go to school, and I can relate everything with that. But make connections, call the different agencies, find out, what can you do? Like Mom said, get on the board. Those are different ways to find out more about the agency, find out more about what you're truly interested in.
Thank you. Paul and Evangeline?
Yeah, the thing that comes to mind has already been shared in a lot of different ways, but it's just connecting with people, being in relationships with people who are different than you or have different stories than you. I think I love what you said, Lamont, about social work is about being uncomfortable. Because just like, yeah, people bring up, you really have this window into people's lives in a really intimate way that you wouldn't otherwise. And so being comfortable with those differences and having compassion for those stories and being exposed to them, I think is something that we can all do at any point in our lives, but especially if you're anticipating a career in social work.
Yeah, I mean, I think I echo that too. The way that I ended up where I am today was just by meeting people. I visited, L'Arche has several communities around the US. So I visited one in Boston while I was in grad school, and that's what sort of led me here, was just meeting people and building relationships with them. So yeah, like Peggy, you mentioned, like volunteering, kind of just trying things out is really the best route. And I guess I can plug a little bit. We do always look for volunteers, and we have part-time positions open in our organization as well. If any students are interested in working with folks with intellectual disabilities and kind of getting some experience there, trying that out. And we have usually a summer internship as well for college students who want to spend the summer actually living in one of our homes for 2 months and kind of getting that more in-depth experience.
Great. Thank you for sharing that. And I want to ask one more question before we transition into the student Q&A where the students can ask questions. So if you could just give me maybe 1 or 2 sentences on why do you find this career rewarding? What makes you feel good at the end of the day or in the middle of the day or when you wake up in the morning about your career?
What makes me feel, each day I get up, I'm excited to get to the office. I have to say that first. But what makes me keep coming back every day is knowing that if I sit here and explain to someone about harm reduction, and they come in and they have an appointment and they say, Lamont, instead of me using 8 bags of heroin a day, I cut it down to 5. Something like that. That is gratifying, not just for me, but for them. And I'm showing them and helping them see this is what needs to be done. And see, in life this way, we don't turn people away. Our main population is Black and brown trans people, but we also have a lot of cisgender clients. And that's the key thing. We're not putting ourselves in a box, even though that's our specific population we're targeting, but being able to know that you made a difference in someone's life. I'll give you an example. We actually pay for people that are homeless, whatever, that needs a state ID and don't have the money for it. To know that when you put a smile on someone's face and say, here's the paperwork, just go to the DM, up to the Secretary of State, and they're going to give you your ID. And they may not have had an ID for 6 months. But now that they have that and being able to help them do that through that process, it gives me joy every day.
Great. Thank you. I appreciate that. And that would give me joy every day too. And part of the reason I like my job is I get to help students find careers and get to pull in fantastic employers like all of you. So, Peggy, what brings you joy? Why do you find your work rewarding?
Just hearing when the clients say, hey, I have a job interview, can you help me get closed? Especially when that person has been in our program for several weeks and was kind of slow moving, and now they're excited about the potential, and that just brings a smile to my face. And like Lamont said, just getting an ID, taking the steps to do things like that, to learn a computer, all of that puts a smile on my face. It's not anything big or major to people, but it is, to that individual. And it makes me happy that they are aware that they can do this. They can do it.
Great. Thanks for sharing that. That is some exciting stuff. And Paul and Evangeline, what is your rewarding piece about this career?
Sure. I mean, it's the people, kind of what you mentioned, Peggy. It's the relationships. It's it's the moments you like walk in and someone says like hi and has a big smile on their face and is like excited to see you, and knowing that it's the fact that you like showed up for them many times in the past that has like led to that moment, I think is the most important. And I think like specifically now in my role, being able to create those experiences for other people is really rewarding and exciting.
Yeah, I would ditto that. I think the relationships, like no one like loves making medical appointments, I don't think, but I love the people I'm making the medical appointments for. And I feel really honored and humbled to be trusted and trusted and seen as a friend. It's all good stuff, the relationships.
Great. Well, it makes me happy to hear what brings all of you joy in your day-to-day work. And now I'd like to open it up to the students. What questions do you have for our panelists? Feel free to unmute and ask or put a question in the chat. We have 6 minutes devoted to your questions, and don't be shy. And if no one has any questions, that's fine too. I can absolutely ask another one of our backup questions. All right. Since no one's asking a question, I'm gonna continue on with one of mine for our last question. So, what advice or resources would all of you recommend to someone who's considering going into social work? What are some things that you would recommend to the students outside of doing volunteering and things like that? Are there other resources that they should consider reviewing or getting involved with?
I would say look at professional organizations that are geared around social work, or if there's a way you want to think outside the box with social work, look at a professional organization in that area. I tell students all the time that in undergraduate and graduate level, so, like volunteering and your internships, they become your projects that you need to submit, whether it's a thesis, a dissertation, or a capstone paper, anything like that. That's what makes it different, because you're taking that lived experience of interning at an organization and you're putting it into your project. And that's what I do. And that's what makes it so much better, because you're then doing things that are passionate to you, and you're seeing your future expand because you're casting your net larger that way compared to staying in that one particular box and area.
Great. Thank you, Lamont. Peggy, is there any advice or resources? Well, I'll repeat that again. I think I froze again. Peggy, is there any resources or advice that you'd give to students who are considering going into social work?
The advice is, don't wear that cape. You're not a superhero, because you will burn yourself out quickly. Patience, listening, understanding, and laugh. You've got to be able to laugh,
Peggy, you are absolutely right. Clients tell me all the time is talking to me. I may say something that is it'll be hilarious, but it's in a way it's like getting them like, oh my God, I never thought of it that way, and things, and having a laugh with the people that you're serving, it makes everything much lighter.
Great. Thanks for both of you for sharing that. And Paul and Evangeline, what are your recommendations for resources or just for general advice for the students?
Yeah, when Peggy shared "Don't Wear the Cape," I haven't read this book, but I just listened to a podcast by the woman who wrote the book. But the book "Rest is Resistance" around, I think it's super relevant to social workers. But I would recommend that book. I think I'll read it and get back to people, but or just listen to a podcast with her. But I also think like resonating with the ethos and philosophy of your workplace is really important, like knowing your why, because there will be hard days and days that feel just entirely exhausting or kind of defeating. And so having something to come back to and feel grounded in, and then just liking your coworkers, I think goes a long way. Like find an environment where there's encouragement and positivity, because if you don't have people to laugh with, if you don't have people to collaborate with, it's not going to be sustainable. So
the laughter piece feels so important. And I think another phrase that's coming to mind is part of our training. We call our assistants in group homes in Illinois are typically called DSPs, or direct support professionals. So as part of our DSP training, there's a line in there that says, don't forget to be a DSP to yourself. And I think that just like resonates a lot. Like, don't forget that in the midst of all of it, like you can only give from a well that has water in it. You can't like pour out of an empty well. And so part of it goes to the being a superhero point as well. You're going to run out of water really quick if you keep putting that cape on every day. So